Next is a stasis eczema, or simply put, it is also called as stasis dermatitis. Hello Sadanand Reddy, very good, warm welcome, very warm welcome. Yes, chalo. This is also called as gravitational or varicose eczema or dermatitis. Both are one and the same, and it is associated with obviously the chronic venous insufficiency. So there will be a patient having the varicose veins. So everything will be there in that picture of this leg. If you are able to see, which is pigmented or which is red in color, which is showing eczematous skin changes, then always you should suspect this stasis eczema. Then always you should suspect this stasis eczema. And there is a classification which is called as CEAP classification. What is CEAP classification? So if you can see here in this table, C is clinical, E is etiological, A is anatomical, and P is pathophysiological. So these are the 4 points which we have to take into consideration to classify the patients of the stasis eczema. So simply in dermatological standpoints, if the patient is having the pigmentation and the eczema, so which category the patient is going to fall into, you can see here it is C4A. So the patient is going to be having C4A category. And if there is a lipodermatosclerosis or the inverted champagne bottle appearance, then what is that? It is C4B. So what is this champagne bottle? This is a champagne bottle. And what is that inverted appearance? So here you can see that the distal part of the leg, it is becoming very constricted. It is becoming very constricted. So it is appearing like an inverted champagne bottle. So this is called as inverted champagne bottle appearance. So remember, dear students, the pigmentation, eczema or lipodermatosclerotic changes, if they are present, always rule out the varicose veins and also send for the color Doppler and also see whether there is any possibility of deep vein thrombosis. And rest of the treatment, varicose veins treatment, if it is done, then the skin condition is also going to be taken care of immediately. Next is, you can see that the patients can also develop the ulceration over the legs. So that is one more point which we need to remember. As you can see here in this picture, the stasis dermatitis patient is having the skin changes which are showing the inflammation, and also you can see that there is this ulcer which is developing in this patient. So there can be ulcer development also in the patients of stasis eczema. So you need to also know among the various causes of the ulcers of the legs, stasis dermatitis is one among them.